Radiation therapy uses high-energy radiation to shrink tumours and kill cancer cells. Radiation kills cancer cells by damaging their DNA. Cancer cells whose DNA is damaged beyond repair stop dividing or die. Each time radiation therapy is given, it involves a balance between destroying cancer cells without causing harm to normal healthy tissue. The goals of radiotherapy can differ between patients depending on the nature and extent of their cancer. Radiation therapy is generally given to cure cancer by eliminating a tumour or prevent cancer recurrence, or both. Radiotherapy may also be given palliatively to relieve symptoms or reduce pain associated with cancer. Radiation therapy may be used in conjunction with surgery and/or chemotherapy to provide the best possible outcome. The majority of patient treatment plans within the Riverina are initially discussed by a large team of medical professionals called multidisciplinary teams, or MDTs. The emphasis is on collaborative decision-making and treatment planning, where the core team members of relevant specialities participate through the MDT meetings to share their knowledge and make collaborative, evidence-based best practice recommendations for patient management. A radiation oncologist develops a patient's treatment plan through a process called treatment planning. Firstly, you'll meet a radiation oncologist for a consultation to discuss your diagnosis and the benefits of radiation therapy, including treatment aims and potential side effects. If you choose to proceed with radiation therapy, your oncologist will ask you to consent to treatment by signing a consent form. An appointment will be made for a planning simulation session. This will take around 45 minutes and be conducted by a team of radiation therapists. During simulation, detailed imaging scans are required to show the location of a patient's tumour and the normal areas around it. Essential to high-quality radiation therapy is ensuring that the patient will be exactly the same position every day relative to the machine delivering the treatment. Special positioning equipment such as head and neck masks and boards could be used for individual patients to make it easier for a patient to stay still. Part of the session is to work out the best method of delivering the treatment. The radiation therapist may indicate that a permanent location mark is required for your treatment, and they will seek your consent for a tattoo to ensure accurate treatment setup and delivery on a daily basis. During the treatment planning session, the radiation therapist will outline a treatment schedule and provide you with the opportunity to ask questions. The number of treatments prescribed by the oncologist varies from patient to patient, and the planning session will also help determine the right number of treatments for you. Radiation therapy treatment at the Riverina Cancer Care Centre is delivered using highly complex machinery called linear accelerators. Our equipment is state-of-the-art and is amongst the very best in the world. The Riverina Cancer Care Centre not only offers patients the best available equipment, but the latest treatment techniques, including intensity modulated radiation therapy and image guided radiation therapy. Your daily treatment sessions will last approximately 15 minutes, and the time of these sessions will generally remain constant through the treatment schedule. The radiation therapist will provide your treatment each day and assess your progress. In addition, a nurse will see you on a regular basis, and your oncologist will generally meet you on a weekly basis. Your team is here to help you and requires your feedback to get the best results. If you have any concerns about your treatment, please notify your radiation therapist, who will organise for you to meet with your oncologist or the nurse as soon as possible.